And we are recording. My name is Lexi Graham, and video 6 of 6 in our 6-part video about ARDS and prone positioning, and this is just a summation of all of the videos. So pulmonary blood flow distribution, just remember that the main way this is talked about is through lung zones 1, 2, and 3. These zones are gravity dependent, so in order for blood flow you have to have proper blood flow, the distribution needs to be adequate because this affects the oxygenation and ventilation. And also you want to maximize the blood that is getting to the patient. Pacelli's law, don't forget that the shorter the tube and the smaller the radius of the tube, you have a higher pressure. But if you have a longer tube and wider radius of the tube, the pressure will be decreased and not as high. For ARDS therapy, ARDS patients have a more of a lack of compliance in the lung. Thus, they're more delicate. So whenever we are treating ARDS patient, we should consider the 5 Ps, which are, as we talked about, perfusion, positioning, protective lung ventilation, protocol weaning, and prevention of complications. So I'm going to make sure they're perfusing correctly, make sure they're in that swimmer's position when you prone them, and that way we're taking pressure off their lungs. When we're talking about protective lung, we want to make sure we have those low tidal volumes and high PEEP. And then make sure they're hitting all of the weaning criteria needed to get them off of the vent and preventing complications like skin breakdown. That way they don't have more complications than when they came in. Protective lung goals, like I said just a second ago, you want the low tidal volumes and high PEEP. And then for the for oxygenation goals, we saw that you will use low PEEP or high FO2, or vice versa with the low FiO2 and high PEEP. And you want to only increase the tidal volumes by 1 milliliter per kilogram. That way we don't cause barotrauma to the patient or volume trauma. And then the prone positioning goals. So the goals are to improve oxygenation and ventilation by taking the weight off the lungs, and also improving the blood flow to the lungs. Getting the patient to their oxygenation goals, but in a safe way with an appropriate amount of pressure to assist moving the patient is the overall goal, and getting them into that swimmer's position to adequately oxygenate and ventilate them. And then I have a few sources right here, and then right here. And that is all for the 6 video series. Thank you for watching.